Now, even with the worldwide concern over the coronavirus, there are still people out there saying that seasonal flu kills far more people, up to 650,000 worldwide every year, which is true, and we aren't making a big fuss about that. But, to coin a phrase, that's because it's one of the known unknowns. We know it will happen every year, and we are prepared for it, even though some years are worse than others. When something like COVID-19 comes along pretty much right out of the blue and into a population with no immunity, it's highly contagious and has a death rate of at least 20 times that of flu, then we have the makings of a major problem. Especially with cheap air travel around the world, it can spread faster now than it ever could have done in the past. As we have seen with China, Italy and now other countries, a large sudden spike in cases requiring hospitalisation can almost crash even the best health services, not to mention the associated economic damage of a shutdown required to contain the outbreak, which in all probability will push the world into a recession. So reacting quickly with the best practices known at the time becomes essential. Even though the virus can't be stopped everywhere, the worst effects can hopefully be mitigated. We haven't seen a major pandemic in living memory. There have been many more localized epidemics involving various strains of flu, other coronaviruses including SARS and MERS, both of which are more deadly than COVID-19, and the most deadliest of them all, Ebola. We have to go back just over 100 years to 1918 to see the world's last truly global pandemic. If we exclude bubonic plague from the Middle Ages, Spanish flu as it became known was the worst health crisis in recorded history, infecting somewhere around 30% of the then world population of about 1.8 billion people and killing somewhere between 17 to 50 million all around the globe. This stands as a solemn reminder of what can happen when a pandemic gets truly out of control. Of course, the circumstances were very different back then. When the Spanish flu pandemic struck in 1918, World War I was still raging, and there was only a very rudimentary knowledge of the viruses and the diseases they caused. We now know that Spanish flu was an outbreak of the H1N1 influenza virus, a type of virus that is common in birds and mammals like pigs, which is why it's sometimes called bird flu or swine flu. It's believed to have jumped the species gap through close contact with infected animals in the food chain. Its exact beginnings are unknown. Some believe it originated in China and then mutated at a US military camp in Kansas before being spread to a British Army hospital in France and onto the front line. Others say that it had been circulating in the European armies for maybe a year or more before it had been noted at the British Army Hospital in 1918. Whichever way it occurred, from there on in and after the war ended, soldiers returning to their home countries spread the infection to the rest of Europe, the US and the British Empire countries before it eventually spread to every inhabited continent in the world. Even in the wilds of Alaska and the islands in the middle of the Pacific, there were recorded deaths due to Spanish flu. But this is where things are different to the current coronavirus or COVID-19. Firstly, the two viruses are not the same. Spanish flu was an influenza virus and COVID-19 is a coronavirus, genetically related to, but not the same as the SARS virus of 2002-2003. So it's not a flu virus, even though some of the symptoms are quite similar. Although the common cold is also a coronavirus, it is much, much less potent than these newly emergent zoonotic viruses like MERS, SARS and now COVID-19. These have jumped from animals to humans in a very short space of time, and because of this, we have no natural or built-up immunity to them. The problem we now face is that in about 80% of the COVID-19 cases, the symptoms are mild, and with many people facing financial hardship due to the measures taken to counter the outbreak, there could be a fair number of them still at work or out and about spreading the virus. This means that the other 20% will need some sort of care or hospitalisation, And if a large number become infected, it becomes a numbers game, with far more people than there are beds or ventilators available, which is what we are now seeing, with all the knock-on effects to other people in the health service too. Back in 1918, the coinciding of the outbreak of Spanish flu with the last year of the war was also instrumental to the spread of the disease, as news about it was suppressed by the US, British, French and Germans for fear that it might compromise morale and show weakness to the enemy, which could be then exploited militarily. Spain was neutral during the war and had no such restrictions on reporting of the outbreak, and thus it became known as Spanish flu simply because they were the only ones reporting it openly. This suppression of information allowed it to spread far more quickly than it would have if more people had known about it. At the time, the general health and hygiene of much of the population was also much lower than it is now. There was much more poverty and malnutrition, especially in Germany, which had been blockaded by the British Navy since the beginning of the war, and by 1918 this was causing a major hardship to the German people, with shortages of fuel and food. These alone led to dramatic increases in diseases caused by malnutrition, such as scurvy, tuberculosis and dysentery, and also added to the increased likelihood of people becoming infected with the flu due to weakened immune systems. Although Spanish flu and COVID-19 are different viruses, they both attack the lungs in a more aggressive way than seasonal flu. Spanish flu was different to seasonal flu because it affected normally fit people in their 20s to 40s, basically the age of the average soldier in the war, rather than the very young or the very old of normal flu. In many of the fatalities, what is now known as a cytokine storm occurred. This is where the body's own immune system and its activating compounds, the cytokines, flood the lungs instead of just the areas where the virus is located. The result is the lungs are damaged by the immune system, leading to much greater inflammation and fluid buildup and allowing secondary bacterial pneumonia to take hold. Now, COVID-19 is said to affect mostly the old and those with underlying health issues, with data from China showing that very few children under the age of 14 being seriously affected. But that doesn't mean that younger people from the age of 15 to 50 aren't as likely to be severely affected by it. COVID-19 is also much more contagious than flu, with each COVID-19 sufferer infecting 2 to 3 others, whereas seasonal flu sufferers infect only 1.3 people. Information from Italy and China is showing that in the most serious cases of COVID-19, the virus attacks the lungs aggressively, creating a large amount of inflammation and fluid buildup, leading to secondary bacterial pneumonia. It's also been found that the virus attacks the heart directly, meaning that anyone with a heart problem, whether they know about it or not, is at a greater risk of a heart attack, as well as severely reduced lung function. The cytokine storms, which were major killers in the Spanish flu, are also common in the worst cases of COVID-19, and if left untreated, are usually fatal. Fortunately, over the last 2 decades and since SARS, much has been learned about how to diagnose and treat cytokine storms, but it requires medical professionals to be aware of it and to identify it quickly. Those who have survived the worst cases of COVID-19 are often found to have been left with lung damage from the scarring of the virus itself and also the overreaction of the immune system. This brings us on to the mortality rate. For Spanish flu, it appears to have been around 2.5%, compared to normal flu of about 0.1%. That's 25 times more deadly. In a report from the Chinese Center for Disease Control and Prevention, the link is in the description if you want to view it, which looked at 42,672 confirmed cases, found that the mortality rate of COVID-19 was 2.3%, or roughly similar to Spanish flu. This means that COVID-19 is 23 times more deadly than seasonal flu. This 2.3% mortality rate was across all ranges from 15 upwards, but above 80 it climbs to 14.8%. As to those who get seriously ill and those who don't depends pretty much on how the individual reacts to the virus, rather than what age they are. An old, fit person with no health issues might have a mild infection, whereas an unfit younger person with health issues could be very seriously ill. The figures are skewed for the over 80s because they are far more likely to have underlying health issues. So, how did the Spanish flu outbreak end? Well, it didn't just fade away after the initial wave. A second, much more deadly mutation spread in France, the US, and Sierra Leone, a British protectorate at the time. It's thought that during the initial wave, civilians who fell seriously ill stayed indoors, and those with the milder form carried on in normal life, spreading the milder form of flu. However, for soldiers at the front, the opposite was true. Those with the mild version stayed at the front, whilst those with the most severe form were sent back, taking the more deadly mutation with them to spread it into the hospitals and onto other new troops which were arriving. This is something that virologists look out for in outbreaks today, because if a virus reaches places where there is large-scale social upheaval, then there is a greater chance for a more deadly mutant strain to develop. In the end, Spanish flu peaked in October 1918, with cases dropping off abruptly in the following month, though its spread carried on more slowly around the world till 1920. The reason for this is believed that the most severe form killed many of those infected and thus it died with them. Another common occurrence is that flu viruses often mutate rapidly, becoming less lethal in the process. We still don't know how COVID-19 will react or mutate in the long run, and that even after containment measures are ended, that it won't bounce back with even greater severity. We will only know this in the fullness of time. Over the years since World War I, much more emphasis was placed on the casualties of the war rather than Spanish flu, and the deadliest pandemic since the bubonic plague, and that probably killed many more people than the war itself, was mostly forgotten about. More recently, since the outbreak of SARS and MERS, the far more deadly versions of coronavirus, there has been a new interest in how and why the Spanish flu spread so widely and was so deadly, so as to understand what might happen in a future pandemic like we are having now. It's been said many times that a new global pandemic is just a matter of when rather than if, but we live in a world that is interconnected in ways which would have been unimaginable back in 1918, with far better knowledge and ability to fight the virus, so it's almost impossible that the results would be the same. But this is still going to pose the biggest health crisis with all the knock-on effects that we have seen in our lifetimes.
And there we have it. We are live.
Very interesting. Informative.
Yes.
I think.
I believe Paul did a great job on that.
So how are things in your neck of the woods?
Spread out. You know,
Or your community spread out. I mean,
yeah, exactly. I mean, it's definitely you're seeing a lot more in the bigger cities, a lot more condensed. But yeah, spread out in this area so far.
Up here, not bad.
Yeah.
You know, it's just being managed. It's not like what's going on, like you mentioned, in the city or in the immediate surrounding area of New York City. So they just gotta, you know, prepare for what we hear all the time, the surge. Because I'll tell you one thing, I really cannot emphasize enough how I feel, and I'm thinking about all those people on the front lines, the healthcare providers, all those that work in the hospitals, all the people that are part of the staff, the custodial aspect of the hospitals, the clinics.
Yep.
We need to protect these people. It's a common sense thing. Because they're the front lines in addressing this virus, and they need to have the adequate supplies necessary in order to do so. Because once that becomes an issue where these people are now getting sick themselves and potentially bringing it home to their families, we're going to have to, like what New York is doing, and I think a few other states are now calling in the reserves, those who have retired, Keith, trying to get them to come back. But then I was thinking to myself, if you ask those folks that were retired from the medical field to come back, Well, retired kind of is the inclination where you're thinking that these people that are coming back are over the age of 60.
Yeah.
And now you're putting them, they're considered high risk. You're putting them at risk. So it's really a selfless act. And the people that are in this profession are selfless people because they're doing it to serve and protect the public. And that's just one area, you know?
Was it Italy or Spain that actually rushed out doctors, graduate doctors that were due to graduate this year? They're allowing them to practice.
Yeah, they're doing that, I think, and from the university and colleges here, I think, too. I'm not sure, don't on that, but I'm sure they're reaching out, and that, they have to, because they're going to need to come up with a backup plan in the event that these folks do come under it. They get the coronavirus, or they're suspected of coming into contact with someone and put into quarantine. But see, the fact is, it's exactly what he just mentioned on that video. This is a numbers game.
Yep.
This is about the capability of the health departments across the country being able to withstand all the patients that are going to be coming in that are going to need medical attention. Obviously, it's going to probably be those that are the higher risk, the seniors, and those with underlying serious medical issues. Because everybody's like trying to make a comparison, which that video was really informative about that, because the difference is it does have commonalities and it has differences of the flu. Right. It's a coronavirus. It is a flu. But the thing is, it's a novel virus. In other words, our bodies have never encountered this type of virus.
We don't have a natural immune.
Exactly. The body is attacking it and trying to deal with it and adapting, and it's really playing, it's just devastating to our immune system. And right now, there are treatments for the flu. We have vaccines, we have treatments, we know what we need to do. For example, when I get sick, and I'm a chronic bronchitis person, they give me, usually, it's the same routine, Keith. They'll tell me, all right, take the azithromycin, which they call the Z-Pack.
Right.
They'll even give me additional amoxicillin or amoxicillin, some other type of antibiotic as well. And they'll provide to me, because of my history, my medical history, they'll give me a pump, like an asthma pump, but it's, and they'll put me on a nebulizer. So obviously for that, there's a treatment. Now, hopefully, without getting too optimistic, without more data coming in with the trials of this combo drug that a lot of people are hearing about, hopefully there's, I would say, a semblance to be a bit optimistic on the treatment part of this. It's not a cure, but maybe there's a treatment that we can all be optimistic about. But at the same time, we have to wait to see how the data comes in, how the patients respond. That New York is doing it here because we have to. Right. How else are you going to deal with a situation when you have over 25,000 cases?
Well, not only that, but the touting of this, treatment, with the Z-Pack and the other stuff, that it takes a very, very hard strain on the heart.
Yeah, and
a lot of people don't realize that.
That's
so not only with the virus itself attacking the lungs and the heart directly, you're going to be putting a medication in that's going to be affecting your heart as well, which is anti-malarial drug. So that's why the tests have to be done. They have to figure out there's something in that malarial drug that they can take out that doesn't affect the heart as much. So there's a whole bunch of stuff going on. Could it work for some? Absolutely. Would I put it out there in a mass market? No, I wouldn't.
Well, the thing is, though, Keith, just to be realistic about it, if it helps some, it's better to help some than none.
Yeah, but once again, they got to find that percentage. You know what I mean? If it's helping 50% and killing the other 50, that's not really good. That's not a good thing. But if it's helping 99% and there's a small 1%, that's really had adverse reactions to it, then yeah, it's something to look at. But once again, we won't know those numbers, and we won't know them for a long time. And most doctors that you talk to will say that they're not prescribing that because it's not proven. And that's what everybody's looking for at this time.
I'm sure they're looking at it on an individual basis.
Correct.
Like I heard remdesivir is something you wouldn't give to someone with high blood pressure. It could actually be fatal.
Yeah.
So, for example, that's also been talked about. And there are others, like they mentioned today during the press briefing, the briefing to the country, the president's briefing with the staff, which Fauci looked like he was ready to walk off the stage at some points. But it's going to be something that they're going to definitely use. They're trying different types of antivirals and different processes and treatment. So this is still in its early stages. We're also looking at the data that's being and what they're using in China and South Korea and other countries.
I think the biggest mistake that a lot of people are making is that they put this social distancing in place so you don't catch the flu. Or don't catch coronavirus. That is the furthest thing from the reason why they're doing it. The reason why they're doing it has nothing to do with you catching it. It has nothing to do with other people passing it on. The reason why they're doing the social distancing right now is there's a good 90% chance that all of us here are going to get it.
Yep.
Okay. The reason why they're doing the social distancing is they want to lower the influx. It's all about our hospitals and our medical capacity.
Exactly.
So if you have everybody spike at once, there's nothing. I mean, you're done. So they're trying to what they call lowering the curve, which is a curve on that graph, to lower it down so everybody gets treatment over a spread out amount of time.
That is exactly what they're trying to do. They're trying to create a scenario where the surge doesn't overwhelm the health departments across the country. Now, obviously, as they mentioned, which is true, but there was a contradiction even on today's press conference today. At one point, there's little going on in some portions in the country, the Farm Belt, and some places in the West. Actually, there's quite a few places. And at the same time, because, the emphasis is we know what this is doing to our economy. We know we need to get the economy up and running. We know that. Mm-hmm. But it seemed to me the emphasis was so much on the economy and less on the emphasis of public health. It makes you kind of wonder. But I get it. I get that we have to get the economy up and going because people cannot not work. And there's going to be an unemployment spike. It's going to be really bad because a lot of people do live check to check, Keith. Right. It's unfortunate, but that's just the case.
What was it? 40% of people in this country can't afford a $400 emergency bill if they had one.
Oh my God! I mean, just like that, exactly. But the thing is, let's not put a timeline. You need to be flexible because everything is in motion right now. At the same time, Fauci was, we need to look at these dark areas. That means the areas that haven't been fully tested, because right now we're not getting in the data coming in from some of these places because testing really hasn't been done adequately enough to know what's going on in these different places.
Right.
So we need to take it easy. Let's get all the facts coming in. Let's not rush. You can be an optimist. You can be a person that's trying to, because that's the role to calm the public down. You don't want this to get out of control. But at the same time, it's also a common sense approach where you have to do what's right, because the professionals, the people that are in the know, that know what they're dealing with here, will tell you, listen, this may not be a 2-week solution. This may take maybe 4 weeks, maybe 8 weeks. We don't know. We don't know when that surge is going to start coming back down again.
Right. So you got to remember too that they're still behind on testing. So you still got that. So I see this increasing a lot in the next 2 or 3 days before we actually start seeing, them caught up within a 24-hour period. I mean, it's gonna take a little bit.
I would say, like for my state, New York, we may be the exception, hopefully, than the rule. Or the state of California or Washington, where the numbers are a little bit higher. Now, New York has over 25,000 right now, but most of that is coming from the metropolis. It's coming from the city. Yep. Up here, our numbers are lower. So you're just going to have to take it by a region by region assessment. The only thing that I'm worried about is other places have yet to even been fully affected. And they may their surges, their climb up may not have even started yet.
Yeah.
So we got to just be careful.
And not only that is one of the scariest things about this virus going around is its incubation period. And they just mentioned something today in the press conference about it, that a lot of people left New York.
Right.
And they're worried about the percentage of people that were infected that don't even know it yet, that have left New York and went to, say, Long Island or Florida or, places like that. And they don't even know they have it.
Right. Like I said, this is not about the death numbers. It's not. I said this on my stream earlier. This is not about how many people are actually dying from this illness. This is about people overwhelming the system by going to the hospitals, to their doctors. Right now, you ask any person, pretty much, I would say over 95% of anyone who right now is practicing in an area that's been hit hard right now, tell them if they have enough supplies. Tell them if they have enough masks, respirators, ventilators, the things they need. How can you expect them to reuse which right there it's totally against protocol, and you're telling them that they need to reuse the same mask 5 times or 10 times or wash them. I mean, we need to get that. And as far as the economy, because David brings it up,
once again, that's just in the metropolises too. Now imagine what happens if that reaches your small town, hospital that only has 40 beds and a certain supply. What happens then? Exactly. You know what I mean? So if your big hospitals, your big metropolis hospitals from New York to LA are running out, imagine what that spells for your smaller guys, your smaller cities, towns.
We have to look at it with a common sense approach.
Right.
Our hospitals are built and our medical facilities are built for a normal flu outbreak, which is a span over a flu season. And yes, thousands of people unfortunately lose their lives every year to the flu. I was looking at the numbers today. I was going over them and comparing them to the COVID globally. The mortality rate, especially under the age of 60, is 0.002. So it's 0.2% right now. But that's not. See, everybody's looking at it and making a comparison. This is not as deadly as the flu. It's not about that. It's about the numbers game. It's about the surge. It's about people being able to go into a hospital and have access to get the medical treatment and care that they need. A respirator may mean the difference between life and death to a senior or to a person who's got a serious underlying condition. Or what about, like I said, we need to get the medical supplies to the people who are on the front lines to protect them, to protect their families. And as far as the economy, right now, essential government is operating. You know that the factories are still going on. You know that the production is going on. And, of course, you can re-enter those folks that already have had the coronavirus and they're now testing negative to get back into the workforce. Obvious.
And I haven't heard any numbers about or any situations like once you have it and get over it, are you still susceptible to it? I haven't heard anything about that.
Neither have I. I was thinking about that today and I was mentioning it.
I mean, is your body going to build up a natural immune to it to help fight it if it comes around again, or are you still listening? I'm guessing your defenses would be, peaked at that time where it wouldn't let it, especially if it's able to get rid of it. But I wouldn't necessarily call it an immune to it.
There is a way, and I am so happy I live in a state with Governor Cuomo, and he is on top of it. He's doing everything he can to stay ahead of the curve on this. He's done everything possible on a state level. And when I seen the conference today, and I forget her name, Dr. Birx, was or I don't remember if it was Dr. Birx or Vice President Pence saying, well, thanks to President Trump, we've got the national private sector, private labs developing tests. Well, guess what, folks? Guess what? A week before, Governor Cuomo was at a facility, at a private lab, practically begging the government, the CDC, to please allow our 200 labs to start producing and making tests. It was the CDC. And then after a few days of back and forth conversation between our governor and the Vice President Pence and the president, all of a sudden, like magic, it was declared that they're going to get the federal government, the CDC was going to now allow the private sector to make these tests.
Yeah.
So, you have to give credit to where credit's due. This is not a point right now where we need to do a blame game or anything else, because it's not about that. And to pat somebody on one shoulder or back. But we have to be responsible right now. When I heard my governor today say there's 20,000 ventilators sitting somewhere. And today, I don't know if you saw the conference, right? Did you see it today?
Yeah, I watched most of it.
He said he sent 4,000 to New York.
Mm-hmm.
Oh, are the other ones still in there? Are they going to California? Where are the other ones? Did he say?
I think he said they were being dispersed between Washington and California, but I'm not positive.
Okay. And this whole thing, and I understand, I get it, that you want the private sector to volunteer. And they're all doing it, as what we understand, they're all doing. They're more than happy to do it. GM, Ford, all these private sector companies are now getting involved in the production of masks, and I heard ventilators. But I heard that Elon Musk was getting ventilators. He was going to get them 1,200. And guess where they're coming from? China.
Yeah. He actually just delivered 1,000 of them.
China, we are so heavily dependent on China for the production of these masks. You have the N95s, right?
Yeah, I have a couple.
Look where it's made. Go take a look where it's made.
Of course. Cheap labor.
China. Mine, behind me, China. So we have to think about, if this is a national emergency, you have the power as president to implement the National Defense Production Act so that you can mandate that certain companies start making the production of the things that we need right now for this environment that we're dealing with right now, to get the masks made, to get the gloves, the gowns, ventilators. Get it done. Yeah. Get it done.
And what scares me a little bit? The people that are normally level-headed about this are even sounding the alarm at this point, saying Phil Mason, who's also known as Thunderfoot here on YouTube, put out a great thing about what if we did nothing. What if people aren't separating themselves like they're supposed to, or quarantining themselves, and it's very interesting. And I'm actually going to play that for you here in a couple minutes. But it's amazing how you almost have to coax people into isolation. And I get it. Not a lot of people like to be, sitting around their house all day, or you have a lot of extroverts out there. I'm an introvert, so I don't really mind that much. But
I am too. I even work from home. It's not like a big issue. But for many out there right now, it's about living, like I said, to provide for their families, to pay their rent, to buy food, to buy medication. Oh my God, I just had to hang up on Lee Spiegel. Oh my. Uh-oh. But I'll call him back after this. The thing is, we need to address the concerns that we're dealing with. And Cuomo made a great point today. Say New York has these, supposedly we need 30,000 ventilators in order to get through this in our hospitals, in our system, medical system. Doesn't mean we're going to hold on to them forever. Right. You give them to the next state that's going to face a crisis. Yep. It's not like we're going to keep the ventilators.
You send them to hotspots when they're no longer needed.
Exactly. It's a common sense approach.
I'll tell you what. Let me play this real quick. About this tells you if it's what would happen if we did nothing. It gives you the real time numbers, the comparison numbers in a spreadsheet, just to give you a little bit of an idea.
How long is it?
Why you need to? I'll play a little bit. I'm not going to play the whole thing, but you'll see. And just pay attention to the numbers, and he tries to get them as close as he can to what we're actually seeing in real life. And it's actually pretty interesting. So check this out.
Viruses are indiscriminate. They affect the young and the old, the rich and the poor alike.
But random, dispassionate, fair to rich and poor alike. They called me a madman.
And with no current effective treatment for the coronavirus and realistic vaccines being over a year away, we have essentially had visited on us the plot of Avengers Endgame. Except rather than half dying, it's 2%. And if we're heroic, we can probably mostly prevent that, but it will be at ginormous cost. And if you think, well, it's only 2%, not that bad.
He did it.
That's still about 200 million people, about 4 times the death toll of World War II. It's a death toll that makes nuking cities seem like amateur hour. And 9/11, well, it's about equivalent to 100,000 times the death toll of 9/11. Now, in my last video, I was actually in a quarantined country, and I made the prediction that the whole of Europe would go that way within a week, and, well, that happened. And America would be about a week afterwards, where they've now already closed the borders and Californians have been ordered to stay at home. The stock market is down about 30%, and it makes previous stock market crashes seem like small potatoes, because unlike those, this one is unlikely to rebound quickly. The simple reason for this, of course, is what you've got to do to limit the spread of the virus, or the consequences of not trying to limit the spread of the virus. Well, we can take China as a model for this. For them, they basically quarantined everything, and they got things mostly back under control in 4 to 6 weeks. And, by the way, if we're going to call this pandemic anything, it should be the air travel pandemic. Now, let me just make a ballpark assumption about the loss of productivity. You know, it's going to be about a month's worth of this year has basically gone bye-bye. Well, what does that constitute? Well, it's about 10% of the working year, so about 10% of the world annual GDP just went bye-bye. Yeah, I know it's not a perfect assumption, but it's in the right league. Or, you know, just as some examples, if you go to any departure board on any airport in the world right now, you'll find that about half of the flights are cancelled. And because of this, of course, there's no one needed to fuel those planes or man the airports, prepare the food, fly the planes, and so forth. And similarly so with the tourist industry. Hell, in the UK alone, the tourist industry is about 10% of the economy. And now it's basically gone. A strong economic growth is a couple of percent, and a recession is merely 2 quarters without growth. Yeah, this is going to be pretty financially devastating. Now, that 30% crash in the market happened despite the actions of basically every large government on the earth, with a central bank trying to throw money at this.
In the space of a week, the British state has become larger than at any point in our economy and over our lives since the 1940s.
What the UK seems to be doing, however, seems to be pretty desperate. £350 billion with a population of some 60 million. That means that the government is putting forward a proposal of about £6,000 for every man, woman and child in the country. That's about a quarter of the average annual salary for every man, woman and child in the country, which I'm sure you'll be shocked to find out the government doesn't actually have. Basically, all these promises are about trying to keep businesses from going bust, because businesses tend to be like people. When they go bust, they rarely come back to life again. In the case of the US government and the European Central Bank, they were both promising $1 trillion per pop towards lessening the effects here. Well, what if we do nothing? Can it really be that bad? In Marvel parlance, what if we just let Thanos get the stones? Well, the best case scenario is you let it burn through the population. So, this is just to give you an idea of what the wild spread of the virus looks like. We started off on day 0 with 1 person infected, and the spread rate here is they spread it to about half an extra person per day. So here we are after about 10 days, and we've got about 200 people infected. Let's keep this running for a little while. So, You hit your first 1,000 at about the 20-day mark, about 3 weeks. Then at about the 1 month mark, you're now up to about 10,000 people infected. By the time you're up to 40 days, it's about 10 million infected. And you hit your first billion just past the 50-day mark. And at 60 days, about 2 months, you're looking at having infected the entire population of the planet.
Now, once again, that's if we did nothing. It's not. This isn't accounting for it. This is telling you infection rates and if we did nothing about it.
So according to Johns Hopkins, about 1/3 of a million people have the virus at the moment, and depending on what fraction.
The states are pulling their weight. They're doing what they need to do to address it for their constituents.
They're working with what they have, pretty much.
Exactly. And the economy, of course, overall, it's definitely devastating.
Mm-hmm.
It is. It's going to definitely have an impact, and that's why I understand the emphasis of getting this to be temporary. But at the same time, public health has to be a concern too. At what cost? Now, as the way I look at it, as long as you have the things that you need out there for the medical people, the workers, if you have the adequate supplies they need, and you try to keep that curve, that wave, that surge as low as possible, and there's nothing else you can do. There really isn't. It's just going to be something where you can manage. And maybe a 2-3 week hiatus, what they're doing right now, is good to allow us to catch up. Mm-hmm. Allow us to resupply and restock and get ourselves back where we can be running at full efficiency. The thing I don't want to hear is, I didn't have a ventilator and we had to let this person die.
Yep.
Because we didn't have enough ventilators. In this country, in the greatest country in the world, and I know there's people that would question that one, but in this country, I think that would be kind of unacceptable on so many levels, moral, ethical, to allow someone to die because you didn't have the proper equipment or means to potentially save their life. That's the only thing that I would be really weary about. And we don't want to even be forced, like they are in Italy, to make that decision.
No.
Who dies?
And unfortunately, they're having to make that decision.
And I know, and this is the thing that bothers me too. I hope that the United States learns a vital lesson in this, and that lesson is, and you got to blame past administrations. You got to blame where blame is due. Allowing companies to outsource, go to China for the cheap labor, and produce the products there. And then in a situation like this, we can't even get access to the proper quantity we need because we can't even make it here.
Yeah.
We got to depend on the from China to come in to resupply us.
Yeah,
that's insane.
And I will give ups to some operations that are switching over, that they know that they're close enough business to it that are now switching over to stuff. I mean, you have who was it? Budweiser that's doing hand sanitizer. A couple of tequila companies, or Budweiser started doing water now. And I will give those companies credit. They are doing what they need to do. Especially when it comes to the alcohol companies, because they're the closest ones that can get to the alcohol to make hand sanitizer and stuff like that. So that's commendable.
Do you know that we have a company here that's creating they're making the hand sanitizer? It's a company that you just mentioned, and you know what they're doing? They're giving it out for free.
Yeah.
And they said, if you want to give us a donation, sure, we'll take the donation, but we're doing this as a public service to the community.
Right, and if it's a company that makes millions a year in profit, and I'm talking about profit, and they want to do that, fine. But I also understand little ones that maybe are just startups, only been doing it a year, making tequila or whatever, and want to do it. And okay, maybe they can charge at cost if they need to, which is still cheaper than trying to sell retail and try to make money off of this.
Yeah.
But
and that's the thing. Like right now, you hear about getting these businesses to develop and make these ventilators. Well, guess what? Ventilators, I think, are on a global demand right now. Wouldn't you say?
Mm-hmm. Easily.
Well, guess what? Right now you can make a business out of manufacturing ventilators and selling them on a global scale. Mm-hmm. So it's not like you're going to jeopardize a business. Think about a clothing store right now that a manufacturer that may not be doing well, and they're told, you know what? Maybe you should think about making masks. Do you know that there's a competition? And this is that problem when I mentioned about the Defense Production Act, that the states are now competing with each other to buy products from companies because they're getting different prices from different states. So
it's insane. It's like an eBay for medical supplies.
Exactly.
It's horrible.
So at the same time that we're using cheap labor in China to make this, well, right now they're willing to pay $4, $5, $6 a mask.
Yep.
So how does that not help to make it here? If you're worried about cost efficiency, well, you're willing right now to pay $4, $5, $6 for a mask.
Well, you looked at some of the big guys are jumping into the loop with the mask thing as well. I just seen Hanes was jumping into it. Fruit of the Loom was jumping into it. Places like that.
3D printing in New York. It's good. There's hundreds being made.
Yeah, there's actually a contest right now, and it says a contest to make it sound like, oh, this is going to be a winner. But no, there's a contest to have for people coming up with 3D printing ventilators. And the best one, they can send it to the site that I think it's like 300. They can print 300 things at a time. So once they come in and it confirms, and they confirm it works, they can send us off and 3D print 300. Now, obviously, 3D printing is not the fastest thing on earth. Mm-hmm. But when you're printing 300 of them at one time, giving them, 13 to 18 hours to do, that's still, basically 300 a day. So 1 week, they're putting out 2,100 of them. So that's not bad.
Every little, I'm sorry. Put it this way: if everybody's doing this, these add up to numbers. So if you have, as that is one example, there must be many examples of this across the country, and they're doing things in similar fashion. So everything helps right now. And like I said, for example, I was streaming live today. While I was on live, I got a call from my House of Representative staff. Mm-hmm. I was like, wow, they're calling me back because I left them a message. I emailed them with a question. And the question was, what about folks that are high risk or seniors that need to go food shopping and to go in a somewhat safe environment? She provided me the information. That was why she was calling me back. But at the same time, she was also giving me additional information, what was going on in my county. Then I asked her, how's the hospital? Because she lives on the other side of where I live. Mm-hmm. I asked her, how is the hospital doing in our area? And she said, manageable, no stress. There is no stress on our hospitals right now. The concern, again, even for me, I'm 80 miles north of New York City. Our hospital, our medical facilities are hanging in there. We've got enough ventilators. We've got enough medical supplies. They haven't, believe it or not, they have enough masks. They have enough right now. It's New York City, where the population is near 9 million. Yep. And they can get overwhelmed in a week or two because people are going to be there's some that are going to require hospitalization. Where are you going to put all these people? They're doing the Javits Center right now, the Army Corps engineers, and I wonder who came up with that idea, by the way. Army engineers finally came in and is working with the state. They're building mobile hospitals. They're doing whatever it takes. I've seen on my local news, because I don't watch the mainstream media, they were building on a soccer field in Washington State. They were building outdoor bedding facilities. I was like, wow, look at Washington do their thing. Yep. So states are doing what they need to do. And of course, we don't want to make this all about a federalization of everything, because there has to be a separation between federal and state. There has to be. Right. They have to be responsible. But at the same time, you're willing to spend clearly near $2 trillion for this package, a stimulus package, and it's going to help a lot of people. It's going to, it's going to put an influx of money in for unemployment, for small business, for people right now who are living check to check, to give them a little extra money to help out in their crisis. The thing is, if you're willing to spend $2 trillion on that, I cannot understand for the life of me why you can't spend what's needed. And I don't know I can't put a value on it because I don't know exactly what's going to cost. But I would say, let's just say $2 billion. Let's just say $2 billion, or even a little less, to make what we need right now to make sure that we get through this crisis. That's what we need. We got to make sure that we can get through this crisis, because I don't want to hear, I'm telling you, I don't want to hear, especially after all the writing was on the wall, that doctors and nurses and all these people that were working in the hospitals, now some of them died because they didn't have the proper equipment, or that people were dying because of a lack of a ventilator. I don't want to hear that, because this should not be a choice between either. You have to do both at the same time.
Yeah, and imagine if it starts coming down to those decisions, whether to let older people die, or if it gets real bad, you start thinking about, well, is it better to give the doctor that's sick a ventilator so he can get well and start treating more people, or one of your loved ones? And you know what I mean? So you don't want it to get that far. And we're not trying to put fear into anybody. You know what I mean? But once again, you have to take this whole situation seriously. You can't, downplay it.
David, this is not a Republican Democrat thing, because the Republicans, if you look at the bill and if you read the bill, we don't know if the money is going to go into corporate pockets, to their stockholders, to their shareholders, to bail out them, instead of where the money needs to go, to the workers.
Right.
And they have to make sure that's a guarantee. Not that they're going to line their own pockets, and because their stocks are dropping and their shareholders are suffering, we have to make sure this is done right. And that's just a fair assessment of it. And the president said today both parties are working together, and they're coming close to a deal. It has to be for everyone. It cannot just be a lopsided thing that you could try to sneak something under the table because it's a crisis and there's pressure in the situation to try to pass one. That's politics, and we're not here to talk politics. But the bottom line is, though, it's not. People keep doing this, and it drives me nuts, Keith. They're
both shifty. You know what I mean? Both of them are trying to pull, rank, and it's just horrible. That's why I'm not even worried about the politics. I mean, they'll figure it out eventually.
Totally agree.
There's nothing that we can do as people to tell them yes or no, or So it's just worry about actually what you can do, and what you can do, and what you should be doing is self-isolation, keeping away from people.
Exactly.
That stuff is proven to work.
Here's the thing that bothers me, and it's been coming up a lot. Well, how many people are dying?
Right.
Again, this is not about this virus being worse or less than a flu. That is not the situation we're dealing with here right now. We're dealing with the overwhelming of our health departments, of our hospitals. They cannot withstand all these people coming at once, all being sick. Why do you think they're trying to slow it down? Like Keith mentioned earlier, this is not about millions of people dying or hundreds of thousands of people dying. It's the mortality rate, and I said this earlier, it's 0.002% under the age 60. Yeah. It's not even 0.2%. We're not talking about people dying. Yes, we are concerned about people dying if they're not getting the proper care and the proper equipment to keep them between a matter of life and death on a ventilator.
Yeah, and some of the smartest science people I know are trying to use that death rate as a way to play it down. And I'm like, sorry, it doesn't work like that.
It's not about that. If this is a respiratory illness and it's a really bad one, and like you put that video, it's affecting other internal vital organs, your body can shut down. If you don't have a ventilator, it could be literally a matter of life and death. And do you want your family member or somebody to have to make a choice or hear from a doctor, listen, I'm sorry, but we don't have a ventilator and there's nothing we can do? Can you imagine being told that? In this country, this great country, being told by a doctor, we don't have what we need to address the critical situation of your family member because we don't have a ventilator.
Right.
Can you be? I mean, it's easy for us all to say, oh, this, that. But put yourself in that person's shoes.
Well, let's just do it this way, okay? You look at the number to the left, 417,966. Okay? Now, right now, that is worldwide for total confirmed cases.
And we
that
can do
number is 1 month. Pretty much.
Okay. But I can do this, and I did this earlier.
This is what I'm talking about. It's 417 for 1 month.
Okay, but let's do 418,000. I'm doing it with the calculator. And I'm going to multiply that by 0.02, which is 2%. That's 8,360 deaths at a 2% rate. Now, the number says 18,000. So if I double that number, that would make it 4%. You follow me?
Mm-hmm.
4% of those that have been confirmed cases, 4% have lost their lives due to the virus. But we also have to think about what happened in Italy, what happened in China. You know, the numbers could be inflated in certain areas. You have to look at it with common sense approach.
Or underreported in some cases.
Oh, exactly. We don't know if the China.
But if you look at the numbers on screen, we got 417,000 confirmed cases. You got 107,000 that are total recovery. Okay. So that leaves, so if you take that number and you take this 18,615 deaths, okay, you take these two numbers right here and minus them from that, that's how many active people in the world right now are sick. Currently sick. And if you think that number, which would be so let's just say 300,000 even, just to make it a little easier. 300,000 people are sick at this current time. You don't think that's taxing the medical industry? Even if you spread all those people out. Now, look at the things that are going on with Wuhan, China, New York City, where it's concentrated.
Right. I would like to see, because I wonder how many beds, and they're sending the Mercy, or I don't know if it's, the Mercy's heading, I think, to San Diego. The Comfort's supposed to come up here to New York City. But they need the beds. And what they need to do, remember, there are people in the hospital right now in ICU for other health-related. We have to think about people in there right now who had a heart attack or are suffering from other serious ICU-related critical care that they need to have. A person with cancer right now could be in an ICU trying to stay alive. You know what I mean? It's not.
Rock just brought up a good point. He was saying about how many deaths are related to regular flu. This one from Johns Hopkins University are only taking the numbers into account of the people that were confirmed.
Exactly.
It's not taking into account of people just had seasonal flu. These numbers are people that actually been confirmed, which is why you'll see it go up every 24 hours because of the more testing that's being done and then added to this database.
How many people in the last month or so it's exploded in the United States, were not tested and they had flu-like symptoms and may have had the coronavirus?
Right. And as I said, we're not trying to do this to scare anybody. Most people, as we see the data coming in, most people that get it will be fine.
Mm-hmm.
Okay.
Vast majority.
Once again, it's the older people you have to worry. And now coming in, the data that's coming in from New York is saying, guess what? You know, you young people, you 20 to 40s, you're not as safe as you thought you were because they're seeing a lot of uptick in people that are sick in that age group.
Do you know a teenager died in, I think it was California, with no underlying issues?
Yeah.
A teenager.
Now I haven't looked into the blood thing yet because a lot of people are saying if you have O-type blood you're less. I mean I'm pretty sure people have looked into that. Mm-hmm. I know that right now there's testing going on with people that have recovered with their blood, using their blood as almost like to produce the antivirals needed, and actually injecting their blood into other people to see if that helps or works. Yep. So there's a lot of things. I have faith in science around the world. I believe somebody will come through with a breakthrough. If not, I mean, I'm pretty sure they would rush a vaccine if they actually found it. You know, and during this whole pandemic, if there's one thing that made me happy was I haven't heard shit from the anti-vaxxers.
And the thing that I keep saying, it's not about the mortality rate necessarily.
Yes.
It's about having the adequate supplies necessary for our healthcare providers. They're the front line.
Yeah.
We need to protect these people. We need to have the equipment that they need to protect themselves, protect it from bringing home to their families. Because I bet you a lot of them aren't even going home.
Mm-hmm.
They don't want to jeopardize their families.
So yeah, so the main thing we want you guys to take away from this is basically heed the warnings.
Yes.
Socially distance, follow your quarantines if you need to. If it's every little thing can help, because once again, these numbers aren't about life and death. These numbers aren't. This is about overtaxing our medical field in the United States. We don't want to overtax it all at one time, so that there is more of a chance that more people that get it can survive. And you know what, guys? If we're separated now and we look back at this, say in September or October, we look back and go, man, we really overreacted with that virus. That means that would just tell us that everything we did at this point in time worked.
Not only that, I'd rather laugh about this later on.
Exactly.
And say, you know what? We went overboard and it wasn't as bad as we thought it was, rather than me saying I lost my mother to it.
Right. And then at that point, we would know it worked. The quarantining ourselves worked.
And like you said, this is a common sense approach. If you do what's necessary, because in everybody's situation, it's different. Yeah. For those who are in New York City, in my own state, it's a lot different from what's going on there to what's going on up here, 80 miles north. Everybody's situation is different. You may live in a community of a population of 50. Mm-hmm. You may be like, I spoke to one of the hosts that do the shows, and he said, Bill, I'm in northern Arizona. We don't have nobody up here. It's all sticks. It's all country. It's all woods. There's not many people in my community. He said in his area, there was only one positive case of coronavirus, the COVID, and it was on a reservation, right. Indian reservation. So it's affecting areas differently. And the thing is, when we look at it, what is the hub of the East Coast? New York.
Yep.
A lot of international flights come in. That was the problem. It wasn't just the flights coming in from China.
Yeah.
It was the other people coming in.
Actually, that makes me wonder, because a lot of international flights either fly into New York, and there's one other spot that they fly into, and I'm wondering how the outbreak is down there. And that would be right here. And there you have it.
You know what I mean? You had all these people coming in, and remember, we heard about the asymptomatic aspect of this. People were positive, but they didn't show symptoms and were walking around, and we had no idea that those people were interacting with other people and spreading the virus. And that's why it exploded in New York, right, because people, you got to remember how densely populated. I don't know if people really understand a subway train in New York City, or a bus, or walking on the streets in Manhattan. It's very densely populated. So you're like, literally, even when you're waiting at a crosswalk to cross the street, people are hugging. They're like next to each other, but like sardines. They're bottled up with each other to cross the street. Right. It's so much close contact. So that's why it's doing what it's doing in New York. And that's why the governor of Florida is saying, if somebody comes into our state from New York, they have to go mandatory quarantine for 14 days, and it's a crime.
Well, Weird Guy's saying around Atlanta, and once again, I haven't confirmed this. I'm just reading what he put. He said around Atlanta, Georgia cases double nearly every 2 days. Still no social distancing happening down there, and school-age kids all over the place because the school is closed. And as you're looking, I brought it down here to Atlanta because Atlanta is a major international hub. A lot of international flights fly into Atlanta. As you can see, Atlanta has a lot of little red dots around it. Now, granted, they're not nowhere near as much as New York. Yeah. But once again, Atlanta is known as a hub for your connecting flights. So a lot of flights, like say if Bill were to fly New York to Dallas, if it's not a New York to Dallas direct flight, he would go New York, Atlanta to Dallas. Right. It's a lot of the flights like that. So it's a connecting flight. So I would not be surprised if a lot spread actually in Atlanta airport. Believe it or not.
We have to remember, they could be, and I pray that this is not the case, and this may be going on in other areas of the country. Remember, when this map started to go into effect, we saw the big spots start to appear. Mm-hmm. And it just grew over time. And we hope that these places that have small amounts don't get to become where they're dealing with a big wave. Right. And that's the whole thing. If you can catch it in these places and isolate them and quarantine now, get ahead of it before it has a chance to spread like it did in New York and some of these other areas, That's what you want to do. You want to try to slow it down. So, like I said, each area, each region is different, obviously, because of population. Every state is different. Every county, every town. We're all living in the different environmental settings. So we have to address it differently. But you just got to have common sense. Do what they're telling you to do. This, like you said, the social distancing, washing your hands before you even think about touching your face, keeping your counters clean, spray down your doorknobs. Do the proper precautions that you just need to do, a common sense approach. And yes, it's just not about the numbers as far as mortality, the death rate. This is about trying to make sure that our health industries are not overwhelmed and that they can handle the flux of patients coming in. That's what this is about, bottom line.
Yeah. As you can see, I'm scanning around just to some big metropolis areas just to give you guys ideas of what the current numbers are. Once again, it updates. This one was updated. Okay, last updated right here, 3/24 at 7:41 p.m. So not that long ago. And you can see Washington State was hit particularly hard. And it looks like the Chicago area is getting hit pretty bad too.
Yeah, it's one of those things where, like I said, and I called my doctor today. They're gonna give me the paperwork tomorrow to pick up, which I'm gonna tell them. I'm gonna call them from outside and tell them to please bring it outside to me to my car because I'm not even walking into the doctor's office. And I'm going to be very careful when they give me the envelope with my paperwork to show that I have heart disease and diabetes. Mm-hmm. And I'm going to call them and say, listen, I'm going to wear my gloves, wear my mask, hand me the envelope out of the car, a window. I'll put it in a plastic bag, tie it up, and then spray the bag with my bleach water combination, put it in the trunk, isolate it. Then obviously I'm going to take my gloves off, get rid of them right there in front of the doctor's office in the garbage can or whatever I got to do, sanitize my hands, do the whole deal. But I'm also getting the paperwork so that, because they told me today, my House of Representative staff member said there's 2 stores that have time slots allocated for seniors and people at high risk. But I want to be able to prove that I do have high risk. I'm a high-risk person because, they might question that. But the thing is also helping seniors. If you're a healthy person, if you have a neighbor, call them. Tell them to order the stuff. They'll go pick it up and drop it off at their front door.
Nassau really exploded with cases, didn't they, on Long Island?
Oh, yeah. A lot of cases on the island.
Nassau got 2,800 and Suffolk got 1,800.
And if you want stuff shipped to your home, if Amazon is price gouging or you don't want to use eBay because they're doing similar practices, and you're not able to have a Walmart delivery sent to your house, I used Instacart. Instacart is coming to my house tomorrow, bringing me food supplies. So Instacart is not available in all areas, but in some areas it is. And that's an option for folks to order your food. And they have everything your local supermarket has because it's using your supermarket chain.
Look at Spain's number.
40,000. Wow. It's bad in Europe. It's really bad in Europe. Oh, France, forget it. 22,000. Wow, look how many deaths.
Yeah, it's
So that 5% death rate. If it's 1,000 out of 20, yeah, that's about a 5%.
What was this one? 22,000 in Italy, 69,000.
And see, now they're more at a closer to a 10%. 6,800 times 10, 68,000. See, they're more like 10% mortality. You know what I mean? It's different it's different in different places. So that's why the numbers. That's why I mentioned earlier, when you look at the overall number, you have to look at individual cases too,
and there's something really fishy about all these red dots and this only being this. For this entire something just ain't right.
They may not be testing their citizens, and they may remember that's a communist country. They may be all ordered to lock down if they violate that, they'll get arrested. Yeah, you know how that works. You know what I mean?
Yeah.
That's a.
Let's see how Iran's doing. I know they were hit pretty bad. Yeah, they're pretty bad as well.
And that's what they're saying.
So we got Iran, Saudi Arabia is not overly bad at this point. And now you have your China, your Wuhan. Yeah, these are where your big numbers are.
Yeah, but they're supposedly they're not getting the cases no more.
But this is encouraging. Let's hope
exactly
as this number goes up, this number starts hopefully catching up. And let's hopefully start to see a 50-50 when they are within 24 hours of testing. That would be great.
And that's another thing too. I called my county. I said, listen, I know how many are right now in my county, but can you tell me where the outbreak is, where most of these cases are happening at? Because I would like to know if it's happening in my area or south of me or west of me. She says, no, we just get the county numbers. We're not getting individual reports of where the cases are coming from within the county. I'm like, I don't know about that one. They know. They have to know.
Where's David at? He's in
Bangkok.
Thailand, right? Where the hell? There it is. Let's see what's going on in his neck of the woods.
Yeah, they said in Venice, they could in Italy, they could actually see, the water's clear. They could actually see fish. There is that thing, the pollution.
Yeah, they even said in China, like the skies are clear. It's like, wow.
Yeah, exactly. You're starting to see that effect, the positive effects. I mean, I don't want to make light of it, but
right. Well, maybe they'll see that and be like, oh, maybe we should start doing something, to curb our cow farts or something.
Or you know what? They should also do something about their wet markets.
Yeah.
Oh my! I mean, they really.
I mean, it's a lovely market of death.
Yeah. Literally, anything that moves, they eat.
Yeah.
It's that. I mean, literally, it's like anything that moves, they'll try and eat.
Yeah, I seen that one dude like sucking on an octopus leg or something. It was still moving. I just gagged and no, it ain't happening.
Oh my god!
But it's different all around the world. Some people like it, I guess. But there you go, David. There's your neck of the woods. 827 confirmed, 4 deaths, 52 recovered.
Look at that.
So yeah, it's very rare that we have a worldwide pandemic, and I think there's only one country left in the world that doesn't have any cases. Somewhere right here, Mali.
Really? Look at that. I'm sure there's got to be a few others. There's got to be.
There's got to be some down in here because you do see a couple. But once again,
What about Antarctica?
Nope, still good.
I figured that.
Yeah, there's actually a story about that not too long ago.
Really?
How Antarctica's still doing all right. But look at South America blowing up too. That's Brazil. I mean, look at that. Over 2,200 cases there. So, wow. Yeah. So what it is, guys? I mean, we just wanted to push home the things. Just stay isolated. Me and Paul had talked about it. We're going to try to do some more streams just to give people something to do.
Hey, you guys need to get to streaming, doing your thing, what you guys do, because people right now, I know you're doing this now, and I've been doing it too. It's time to lay off this because people are so stressed out. They're tired of hearing it. You know what?
I agree.
It's time to get people's minds off of this because everybody's under so much.
Well, the main reason we decided to do this was because of the fact that there was so much misinformation going out and people saying that it was just like the flu. And once again, Bill, me, a lot of my family's in the medical field. Mm-hmm. I was tired of seeing people trying to compare it to the flu. When it's nothing like it. And we have to watch out for those frontline workers, obviously. But once again, if you just do, what's recommended, this is the first time ever in history that we all been asked to sit at home on our asses. So try to enjoy that if you can. Yes, I know a lot of people are stressed out about money and stuff like that. Don't worry. I'm pretty sure, the governments will get their, I don't even care about language. They'll get their shit together. They have no choice but to. And start sending out these packages to try to help people and businesses and whatnot. So, if you can, just, sit at home, relax, make use of these. We Imagine right now if we didn't have the internet.
Oh.
So use that to your advantage. I know Comcast had just turned on like 4 or 5 more servers throughout the United States to handle the internet traffic. I know Verizon was doing the same thing. They're bringing 2 or 3 that weren't really online. They rushed to get them online so they can handle the traffic. Netflix has been asked to drop quality down to 720, as with other streaming services, just to help, because they know there's going to be a lot of increase in internet traffic around the world. So, try to enjoy it. I mean, this is what Skype was built for. This is what, Facebook video chat was built for. You can play games over Skype. You can play games over FaceTime. You can talk to one another that way. Just stay in your house, and it's just use a no touching policy. Wash your hands like they're telling you, because once again, soap is probably the most effective way. So, we're just gonna have to put up with it, guys. But by no means do not underestimate this, and just say, "Oh, I doubt I'm going to get it because I live in bumfuck Egypt." It's not going to happen. You can still get it. There are studies going on right now about how long it lasts on surfaces. It's not really an airborne virus, which is good. So just be cautious. That's it.
I'll just say one complaint that I have. It's a very selfish one. I have no sports to watch.
Yeah, that's kind of horrible.
I mean, it's like, wow.
But I did get an email from the WWE today telling me that if I did end up going live, and I will spread this out to you guys, the WWE Network will be free for anybody. I don't remember when exactly they said it would be, but anybody can get it. Now I know a lot of people aren't wrestling fans. This is just a company I used to work for. They said that it would be available free, so any of you can get it if you wanted to watch anything from the 1970s to now. It's all on there. So there's another option for you.
I agree with David. Can you imagine the baby boom?
Yeah. There's going to be a lot of babies.
There's going to be a lot of babies. The hospitals may have to come up with some preparation for that one alone.
Yeah.
Well, they're going to have to get ready for that, because that's going to probably happen too. They're going to be overwhelmed with all the births going on. So
you got that. You got the porn people offering free porn. Who was it? Who was the big porn people? I forget the name of the company, but they were offering over in the UK or something. They were offering just free memberships to that. So yeah, you're going to have a baby boom. You're going to have COVID babies.
Yeah, and can you imagine some inventive names?
Yeah, Covennials.
Oh boy, I don't even want to touch that one. But the thing is, too, we have to have. I like, for myself, and I know how Keith is, because Keith has a wicked sense of humor. So does Mark. But you have to keep light in this too. You can't let this consume you. You can't let the fear porn get to you, because there's a lot of that out there. Just be rational, logical. Just address this the way common sense approach, and just do it the right way, and everything's going to be fine. Everything's going to, I mean, it is like a flu epidemic, but just, it's a little bit more severe. But just do the common sense approach, and we're all going to get through this together, and we're going to be fine. A few months from now, Keith and I know we're going to talk about it, and we'll be laughing about certain things. But at the same time, we also have to think about, sadly, all those people who eventually have lost their lives due to this. But that goes without saying. That goes with the flu season, tens of thousands of people.
Pornhub.
And that's just the United States.
That's what it was.
So, there's all kinds of things that we deal with. Think about and I don't want to get into go ranting off on another off-tangent subject, but think about all the people that suffer from the crime out there that lose their lives. So there's a lot of things going on out there. And, we're focused on this. The whole world is focused on this. And the media is a 24/7 hit you over the head kind of a thing, which is why I tell my mom not to watch it. I don't watch it because I can't take it.
Yeah, it's tough watching it every day, because usually you see the same thing every day anyway, except for the numbers are different.
Another thing, too, there's going to be a mental health need, definitely. Mm-hmm. Not just now, but definitely afterwards, because there's going to be a lot of people that are going to go through a lot of anxieties and all kinds of things. So, and I would say, closing, because I think Keith is getting ready to wrap up. If you go outside eventually, when you do, or if you're able to now, show appreciation to those people that are out there working selflessly. The person that's working at the grocery store, or the trucker, or the people that are working in the hospitals, the police that are out there all
your
those
local convenience store.
Anywhere. All these people that are out there working because they're considered essential, tell them thank you. I'm sure they would appreciate that because they probably don't hear it enough.
Yep.
So show them appreciation in this time and tell them thank you if you can, because I think that would be helpful for them. And it's very supportive. And I think that's the right thing to do at this point in this juncture. You know, I think that's what I'm going to do. Whenever I go outside, I'm going to say thank you for being here. Thank you for doing this.
Absolutely. And on that note, I think we'll end the stream there. Once again, everybody just be safe, be smart. You know, stay home. Just stay home. Okay.
If you can.
Yes. If at all possible, just stay home and relax. And hopefully tomorrow night we'll be back with the infrared sky cam for P&K, along with some early morning streams since Paul has the mall shut down there. So, yeah. So hopefully we'll get on it that way. I want to thank Bill for being with me. Bill, New York Skywatcher. Jump over there, check out that channel. We're on Skywatcher Gaming, which he's probably going to go on right after we're done here. So, yeah. So I figured we just have a hangout and just have a little chit chat about this, guys. But let's hopefully we return to somewhat normalcy tomorrow night. Let me go ahead and start trying the infrared sky cam again, trying to tone that thing in and get it done. And of course, do early morning streams as well. So everybody, be safe.
Yes.
Don't fall for bullshit. Just relax and take care.
Good night.
Yep. We'll talk to you guys later.
Thank you.